As another lockdown begins, the UK is a country still trying to come to terms with the new variant of COVID-19, up to 70% more transmissible.
As I speak to you tonight, our hospitals are under more pressure from COVID than at any time since the start of the pandemic.
Just weeks ago, vaccine approval injected much-needed hope at the end of a most challenging year. Case numbers were down, Christmas brought eased measures. But now families across the nation are again grappling with how to manage this latest government U-turn, having to homeschool children after just one day of the school term.
My initial feeling was a bit of shock at the announcement last night, and mainly to do with the amount of time.
A sentiment echoed by many Brits.
You're thinking, okay, there will be school on Monday and then there won't be school. It's just too much conflicting information.
They acted slow the first time, putting us in the first lockdown. They've not learnt any lessons and acted slow again. So, disappointed.
It's like, well, what are we doing? Make up your mind. Let's figure this out and do it once and for all and do it well instead of in and out of lockdown all the time. It's very hard.
New figures put the UK on course to exceed 100,000 COVID-related deaths before the end of the month. Boris Johnson's message seems sensible. Stay at home.
But there have been criticisms of the government. That's because this national lockdown was not announced before Christmas. Over the last 2 weeks, on London hospital wards, the number of people being treated for COVID-19 has increased by 68%, which has led many to suggest the government should have acted sooner.
Could have acted more quickly.
Dr. Ben Marisapu is an expert in social care and has been supporting elderly patients throughout the pandemic.
We have been on the back foot and there have been repeated U-turns. That causes confusion, it causes concern. It also means that COVID-19 has had potentially more opportunity to spread than if we had got a handle on it earlier on in the process and earlier on in this spike, which is now really out of control.
The government hopes to vaccinate 12 million of the most vulnerable in society by mid-February, with Boris Johnson, perhaps wishfully, referring to this lockdown period as the last phase of the struggle. I'm Luke Hanrahan for Newsy in London.